I've been playing basketball ever since I was in secondary school. I was training, but I suddenly fell down and I hit my head down. So I went to Huruma Lions Clinic. Some of the doctors told me that I go for X-ray so that I may be sure that I'm epileptic. I learned about different clinics, and since I was staying in Nairobi, I had to fight my file to be brought to this place because I was told that there's another clinic in Karen Health Center. So now I can do anything for myself, come for my drugs for myself, because I'm right here, I'm staying right here.
We have different types of epilepsy, general seizures and the partial seizures. For the partial seizures, they are just like, they don't lose consciousness. But mainly the one that we know is the generalized tonic-clonic seizures, the one that there is stiffness of the body. Mainly, it starts with a loud cry. Then there's that jerking. During that jerking, you might find a patient having a tongue bite or clenching of the teeth. For a follow-up clinic, that patient feels a sense of belonging. There are some people who understand my condition. It's important for them to do a follow-up clinic to avoid either complications of the condition.
I started the first epilepsy clinic in Matari. One of the church organizations given us some space. They themselves are looking after some handicapped children, and many of them were with epilepsy. We were giving free treatment, and we were giving the basic drugs.
KCDF partners with organizations who have identified a need and a livelihood challenge that their particular community is undergoing. For KAWE, they work with people living with epilepsy. One of the things that KAWE does is provide medicine for people living with epilepsy. So they have 3 clinics in Nairobi where they serve a very big number of people with epilepsy.
We use our clinics to do this awareness and education people. Plus we have people we train, our social workers and volunteers, and they go out and spread the gospel.
You have seen this beautiful container. Actually, we call it home. KCDF came in to help us get a grant to put up this container on that side. The services are offered once a week on a Wednesday from 9 to 5. The people who come as far as Kitale, so they are given a longer period, even up to 9 months, 6 to 9 months, so that they are not coming all the time. They're able to come twice a year for their appointments. I really appreciate the fact that KCDF came in to help this dire situation, which today we enjoy.
Our results, by using very simple basic drugs, generics as they say, but we can treat a patient with epilepsy with a minimum of 200 shillings up to maximum of 500 shillings per month.
When I was a second year at the University of Nairobi, that was around 1987, is when I started experiencing a funny problem. Let's say the lecture is going on, I just stand up and start walking in the lecture room because I didn't know what was whatever the issue with him. Then one time a doctor told me to go to Kenyatta Hospital to be checked the brainwaves. So when I went there, they were checked, and then the doctor told me, we have come to a conclusion that you have epilepsy. I tried my best, but stress was really a lot. Then there's a time a doctor just told me, now if you want to be able to tackle epilepsy well, one thing you have to accept, you have it and you'll continue with life. Otherwise, if you don't accept you have it and you'll continue with life, even drugs cannot do anything because it's something concerning the brain. People from our community, like lawyers, they take epilepsy, they take it very, very badly. Because I remember the time I went for my grandfather's funeral, nobody was greeting me. Because I bring a hand, they just take it far from me. But me at that time, I was in this association of KAWE, so I didn't feel anything. KAWE is a very wonderful association because counseling is just 200 shillings. And then you find the drugs, let's say a drug which is 18 shillings in the pharmacy, you find it can be 5 shillings there or 3 shillings.
I have a diploma in French language. So, but when I had this problem, I couldn't do anything. My body was weak. So I stayed about 3 years without drinking. But suddenly when I started using these drugs, I can go for training, I can go to teach. And right now, I have a wife and I have a 6-month girl.
If you're looking at the contribution we make, the number of patients now we have registered already, on our 3 clinics are more than 16,000. There are at least 4,000 or 5,000 who are active. Besides this, we train people and all interested parties who want to help people with epilepsy around the country. Do you know we have more than 30 clinics, that are our satellite clinics around the country, supported by KAWE.
I want to really thank these KAWE people, for if it wasn't for them, I wouldn't be here. And even sometimes I don't think I have it. I have it when I come here, that's when I think, maybe I get to get some medicine. But without coming here, I'm like, I'm good.
2 in the morning and 2 at night.
Epilepsy is treatable, and someone with epilepsy can live a full life, a normal life.
I've not been falling for about 5 years. I have a sister married in Mombasa. She has to come all this way just for drugs. It will be very good if these clinics, KAWE clinic, all these drugs are going to reach all the other areas in Kenya.